In this video, I will briefly tell you about the beta and alpha antagonist, beta and alpha blockers. First of all, you should know that adrenergic nerve endings are basically mainly they are sympathetic nerve endings that release adrenaline or non-adrenaline at the nerve endings and increase the sympathetic outflow. Basically, they act on two type of receptors, which are adrenergic receptors, and adrenergic receptors are of two types. They are alpha adrenergic receptors, or there are beta adrenergic receptors. Alpha adrenergic receptor can be alpha 1 or alpha 2, and beta adrenergic receptors can also be alpha 1 and alpha 2. Beta 1 adrenergic receptors are basically present on your heart, like they are present on the SA node, they are present on the AV node, they are present on the contractile myocardium, which includes your atrium, your ventricle, and they are even also present on the juxtaglomerular apparatus of your kidney. This is a specialized apparatus which is a blood pressure measuring device of your kidney that senses sodium and water concentration in the tubular fluid and accordingly regulate your blood pressure. They also have this juxta apparatus also has innervation from your sympathetic nerve endings, and those sympathetic nerve endings act on beta 1 receptors present on the juxta apparatus to bring about changes in your blood pressure. So when the adrenaline or non-adrenaline is released, it increases your sympathetic outflow. So what does that mean? If it acts on the SA node, SA node is basically a pacemaker which increases or which produces impulses per minute of your heart. It maintains your heartbeat. So if there is increased adrenergic stimulation on the SA node, the heartbeat is increased, heart rate is increased, number of impulses generated per minute is increased, and your heart rate is increased. And if actually this effect of increasing heart rate via your sympathetic adrenergic stimulation is known as positive chronotropy. And when your beta 1 adrenergic receptors are stimulated because of sympathetic nerve endings that are located that basically act on your AV node. If AV node is stimulated because of that, it leads to increase in conduction velocity of impulses from atria to ventricle. Conduction velocity this time is increased because impulses are conducted from atria to ventricle via AV node, and this conduction velocity is increased if AV node is stimulated. So more impulses are conducted in a given time from atria to ventricle, and this effect is known as positive donotropy. And if beta 1 receptors, which are located on your atria and ventricle, they are stimulated by these sympathetic nerve endings that release norepinephrine, it leads to increase in contractility of atria and ventricle. This means increase stroke volume, increase cardiac output, and you can say increase systolic blood pressure. So this effect of increasing the contractility is known as positive inotropy. And when these receptors are stimulated on the kidney, they lead to increase in renin production. So when beta 1 receptors on the juxtaglomerular apparatus, they are stimulated, they lead to increase in your blood pressure. Basically what happens is basically juxtaglomerular apparatus releases renin. Renin is a protease which converts basically angiotensinogen into angiotensin 1 and angiotensin 1 to angiotensin 2. This is angiotensinogen is converted into angiotensin 1 by renin. Angiotensin 1 to angiotensin 2 is converted by ACE. ACE is angiotensin converting enzyme. When angiotensinogen is basically produced by the liver, this is acted upon by renin, which is produced from the juxta apparatus from the kidney. to produce angiotensin 1. Angiotensin 1, as it circulates in the blood, it reaches the pulmonary vasculature. From there, from the endothelium of vasculature of pulmonary system, ACE is released, angiotensin converting enzyme is released, that converts 1 into angiotensin 2. And angiotensin 2 basically has many functions. It is an arterioconstrictor, venoconstrictor. It also acts on the zona glomerulosa of adrenal gland to increase the production of aldosterone. And aldosterone basically leads to retention of salt and water. This also enhances blood pressure. And when angiotensin 2 constricts arteries and veins, it increases the when arteries are constricted, basically total peripheral resistance is increased and diastolic blood pressure is raised. And when angiotensin 2 acts on a vein and constricts them, basically venoconstriction leads to increase in venous return to the heart and diastolic volume is increased. And when diastolic volume is increased, cardiac output is increased, stroke volume is increased, systolic blood pressure is increased. So this is how, when juxta senses low blood pressure, it enhances your blood pressure in this way by the renin angiotensin aldosterone system.